Hi, my name is SYAZIRAH DAYANA. Our group member will present chapter 10, which is disease of respiratory system. Before that, I will explain a bit about the structure of respiratory system. They were divided by two, upper and lower tract. Upper tract include nose, nasal cavity, pharynx, and larynx, while lower tract, they consist of the trachea, bronchi, bronchioles, and alveoli. This structure ensures efficient of oxygen intake and carbon dioxide removal. There are several diseases associated with respiratory system. These include chronic obstructive pulmonary disease (COPD), asthma, acute respiratory failure, influenza, pneumonia, and vaping-related disorder. They are classified under ICD-10 code J00 until J99. Moving on, I will explain about the COPD and asthma disease. COPD is chronic lung disease, while asthma is chronic respiratory condition. Both causes difficulty in breathing. For COPD and asthma patient, they might face acute exacerbation. We use code in category J44 and J45 to distinguish between uncomplicated cases and acute exacerbation. Uncomplicated cases is where the patient's condition are stable, while acute exacerbation is when the patient suddenly had a hard time breathing and need immediate attention. It's important to know this because the treatment are different depending on how severe the problem are. In addition, while infection like pneumonia can cause exacerbation, not all due to infection. Exacerbation can also be triggered by environmental factors, allergies, or other non-infectious factors.
Hi, I am NURHIDAYAH DIAN binti AJAH and I will explain about respiratory failure. As we know, respiratory failure is a serious condition that makes us difficult to breathe on our own. Respiratory failure develops when the lungs can't get enough oxygen in the blood. Acute respiratory failures happen quickly and without much warning. It is often caused by a disease or injury that affect your breathing, such as pneumonia, opioid overdose, stroke, or a lung or spinal cord injury. Respiratory failure can also develop slowly, and when it does, it is called chronic respiratory failure. There, it will show some symptoms that including shortness of breath or feeling like you can't get enough air, extreme tiredness, and inability to exercise as you did before, and sleepiness. We can see that acute respiratory failure with code J96.0 in two conditions, which is first, when a patient's respiratory failure is the primary cause of their hospital admission. Both acute and chronic respiratory failure with code J96.2 may be diagnosed as the primary diagnosis. However, chapter-specific coding guidelines such as obstetric, poisoning, HIV, and newborn that provide sequencing direction take precedence. And for second condition, if respiratory failure is present before admissions but does not fit the definitions of a major diagnosis, it may be recorded as a secondary diagnosis if it develops after admission.
Thank you, Dian, for your explanation. Hi, my name is AFIFAH Muhammad KAMARUDIN, and I will continue with the next slide, which is influenza due to certain influenza viruses. So what is influenza? Influenza, known as the flu, is a highly contagious respiratory disease that is caused by various viruses. It infects the nose, throat, and lungs. Influenza can be coded for J09, J10, and J11. J09 is used for influenza caused by certain identified viruses like avian flu or other novel influenza A viruses, while J10 is for influenza caused by other identified viruses like H1N1 or H3N2, which are not considered novel or variant. It is important to note that these codes are only for confirmed cases of influenza. However, confirmed doesn't mean to always need positive lab testing. We can use these codes based on the doctor's diagnosis. If the doctor says the patient has avian flu or another novel influenza A, we use J09. If it's another identified strain like H1N1 or H3N2, we use J10. For cases where the doctor says the patient might have or probably has influenza but it's not confirmed, we use the code J11. This is for suspected or possible cases and means the specific virus is not identified.
So now I'm going to talk about ventilator-associated pneumonia. First thing first, we need to know the definitions of pneumonia itself. So pneumonia can be defined as infection to your lung due to viruses, bacterials, and fungi. So this disease can cause inflammations to your lung tissue, and it can also cause pus in your lung. So there are a lot of types of pneumonia, but the most common ones would be viral pneumonia, mycoplasma pneumonia, and bacterial pneumonia. So the questions that will come in mind is, how can you code these conditions? For ventilator-associated pneumonia, there is one specific code that can be used, which is J95.851. But you need to remember that for this code, it can only be used when the provider has documented these conditions. If you put J95.851 code as your main code, you need to identify the organism that has affected the lungs as your additional code. But you need to be careful to not put the code from the range of J12 up until J18. As for ventilator-associated pneumonia after admissions, the J95.851 code would be the additional code, and for the main code, it will be the types of pneumonia that has made the patients comes into the hospital or being admitted. But for this case, you can assign or you can put the range of code from J12 up until J18.
Hello, my name is QISTINA Binti EZAN. Now I will explain about the vaping related disorders. First of all, any vaping related disorders should be assigned with code U07.0 to patients who appear with a condition or conditions associated with vaping. Also, lung injury related to vaping can only be assigned with code U07.0. Next, provides additional codes pertaining to various manifestations such as pneumonitis, J68.0. When a definitive diagnosis has been confirmed, associated respiratory signs and symptoms due to vaping, such as cough and shortness of breath, they are not coded separately. However, any gastrointestinal symptoms such as diarrhea and abdominal pain needs to be coded separately. That is all for the subtopics under this topic, and we will move on to case study. We have found a case study of a 70-year-old patient with decompensated chronic obstructive pulmonary disease and is admitted to the hospital with acute exacerbation of bronchial asthma. For this case, the principal diagnosis should be coded as J44.1 and the secondary diagnosis should be coded as J45.901. Last but not least, we have a fun fact for everyone. You lose a lot of water just by breathing. When at rest, humans exhale up to 17.5 milliliters of water per hour. The fun fact was according to an article in the 2012 Journal of Polish Pneumonology and Allergology. And this ends our presentation for today. Thank you!